Welcome to the most commonly used medications in respiratory care. These are the drug classes that we will take separately in later lessons, but to help you get started with your Research Project 1, we will go ahead and do an overview of the most common drug classes used in respiratory care. Please feel free to use these tables when discussing your chosen respiratory diseases. You will find that some of your medications will list the pharmacokinetics for each drug within the drug class, and I will point them out on these slides. The first category of respiratory medications are the orphan drugs listed in Table 1-2. Note that Dornase alpha, pulmazine, and tobramycin fall into this category. For those of you that choose cystic fibrosis as your Research Project 1, please make note of these medications. For students choosing COPD as their Research Project 1, A-1 proteinase inhibitors, such as prolastin, will be of interest as it treats a form of COPD called alpha-1 antitrypsin deficiency. Medications on Table 1-4 include our adrenergic bronchodilators, such as albuterol, and long-acting adrenergics, such as salmeterol, Ceravent, our anticholinergics, such as ipratropium bromide, Atrovent, and long-acting anticholinergics, such as tiotropium bromide, Spiriva. Of course, we are familiar with these medications we use every day. Other medications of interest are corticosteroids that are used in asthma that is not controlled with bronchodilators and anti-asthmatic agents that prevent onset or development of asthmatic response to the chemical reactions created by inflammation. Anti-infectives are also useful for treatment of Pseudomonas development in cystic fibrosis, and prostacyclin analogs are useful for pulmonary hypertension. On this table, we are focused on sympathomimetics since they are our most common bronchodilators. The sympatholytics we will focus on when we address Research Project 2. This slide further breaks down the sympathomimetic, also called adrenergic bronchodilators, into ultra-short through long-acting bronchodilators. A particular note, this slide does describe the pharmacokinetics of these bronchodilators, which is indicated by onset, peak, and duration on the far right column of this slide. Table 7-1 illustrates another common group of bronchodilators, or anticholinergic or sympatholytic bronchodilators. Again, in this slide, we observe the pharmacokinetics of these agents in the far right column. Although we will not focus on this chapter, a couple of medications of interest in treating mucus thickening and plugging and many of our respiratory diseases would be our N-acetylcysteine, commonly known as Mucomyst, and again, Dornase alpha or pulmazine for cystic fibrosis. In Table 11-1, we can observe the common corticosteroids used in both Step 2 asthma and COPD. Step 2 asthma is asthma symptoms that occur more than 2 days per week, but not daily, or night awakenings with asthma occurring 3 to 4 nights per month. They are also often initiated in COPD due to the chronic inflammatory processes that co-concur with other symptoms. Table 11-2 shows us the combination bronchodilators and corticosteroids that are often seen clinically in the adult and child dosages. Please note that for the purposes of this class, we are interested in adult dosages, with the exception of cystic fibrosis medications. This table mainly focuses on our non-steroidal anti-asthma agents and should be mentioned in Research Project 1 if you choose asthma as your disease. Table 12-2 will further assist you in pharmacokinetics, side effects, drug interactions, and contraindications of some of the non-steroidal anti-asthma agents. The only medication on this table of interest is again the anti-infective tobramycin for Pseudomonas in our cystic fibrosis patients. In Chapter 16, Selected Agents of Pulmonary Value, Table 16-1, shows us some of the medications that are used to treat alpha-1 antitrypsin deficiency, which is a genetic defect that leads to the development of severe panacenar emphysema, which is characterized by relatively uniform enlargement of the air spaces throughout the terminal bronchioles and alveoli. Lastly, in this chapter, you will see the list of commonly used smoking cessation drugs that are important in the prevention of COPD development, since we know that cigarette smoking is the most common cause of the development of COPD.